Although we would like to have you being here in person, we are trying to make our very best to give you an impression of what is happening here and what is in store for the next generation of dentists to be educated at Columbia. One of the impressive features that have been incorporated here is the Center for Precision Dental Medicine. The center has a unique infrastructure to provide us with data that inform students and faculty about the best treatment for a particular patient. And I'm proud to say that your college, the College of Dental Medicine, is one of the first ones to enter into that space.
The BC5 clinic has made a huge difference in my preclinical training. The space is open, modern, and it has the latest digital technology too. The dental chairs are even wired to collect data. They recognize and can track the movement of dental instruments we're using and can even sense things like heart rate levels to help monitor patient stress. These chairs are really, though, just the tip of the iceberg when it comes to Columbia's clinics, and the education that I'm receiving really does feel cutting edge. As a scholarship recipient, I feel super lucky and very grateful to those who have helped to make my training at Columbia possible.
Another new space is the new Vagelos Education Center. This 14-story award-winning building is where our students take classes in the basic sciences. For the first 18 months, our dental students take their courses alongside the medical students. Among the courses include gross anatomy, psychiatric medicine, and the body and health and disease. Interprofessional education at the medical center continues to expand and includes physical and occupational therapy, social work, nursing, medicine, and public health. This interdisciplinary approach with our dental students allows them to become integral members of the healthcare team.
What I love about the Vagelos Education Center is the opportunity to learn in such an incredibly modern space. All of the classrooms and the study spaces just makes the experience of learning there just that much better. Despite the challenges of having to start dental school online, Columbia has really prioritized giving us that in-person gross cadaver lab experience in the anatomy lab at the Vagelos Education Center. So I'm really glad that Columbia has prioritized in-person experiences, especially since so many medical and dental schools across the country had to cut that part out of the education. As I finish up my first year, I'm really looking forward to second year when we can round out our medical education as well as advance our clinical skills so that we'll be able to see our patients as oral health providers in our third and fourth year.
In addition to our teaching clinics that now have expanded to 4 floors in Vanderbilt Clinic, our full-time faculty practice out of 5 faculty practice sites that are part of Columbia Doctors and part of ColumbiaDoctors Dentistry. 2 of the sites are at our medical center here, right in the heart of CUMC. One is dedicated to oral surgery, and the other facility is dedicated to comprehensive care. We do have 2 other sites down by our Morningside campus. These sites serve our neighbors and our colleagues in Harlem and in Morningside Heights. And the fantastic thing is that there's been a new campus, Manhattanville, constructed right next to our 2 dental facilities. This is a sprawling 17-acre campus that is open access to the public. It is dedicated to providing research and integrating knowledge and bringing in students in a global way to actually come in contact with both the public and with our professors and our researchers. And we're excited that our practices down there can serve all the new staff, administration, researchers, and students that now will be occupying Manhattanville. Finally, to show our true integration with Columbia Doctors, our 5th practice is located down in Rockefeller Center, right adjacent, integrating with primary care and other medical specialties. And I believe this fulfills Dr. Stohler's vision that quality oral health is important for the patient's overall health needs.
The Columbia campus neighborhood is kind of like a small town inside of a bigger city, which is exactly how it feels to be a part of Columbia University. I'm part of an amazing group of people who strive for excellence and hope to change the world for the better. My goal as a practitioner is to continue to provide the highest level of care and to also go out and serve the underserved population, as I've been doing here at Columbia University.